Washington Irving once said, "There is a sacredness in tears. They are not the mark of weakness, but of power. They speak more eloquently than 10,000 tongues. They are the messengers of overwhelming grief, of deep contrition, or of unspeakable love." Normal human tears are a biologic wonder, composed of a watery portion for providing the cornea hydration and nutrition, a mucus lubrication component for making a tear slimy, and a third thin layer of oil for slowing evaporation. Put together, you have the astonishing, life-sustaining, curative, slippery, and slow-to-evaporate human tear. Vision is completely dependent on tears because of the cornea. For purposes of transparency, is designed without blood vessels and is kept alive only by the nutrition it receives from tears. Dry eye is from many causes involving the eye surface. It is further described as symptoms from the loss of the effectiveness of tear film. These symptoms include pain, itching, burning, redness, and mucus around the eye with fluctuating vision that interferes with recreation, reading, and even driving. Paradoxically, watery eyes usually indicate a dry and inflamed eye with reactive and poor quality tears. The most common causes for dry eye are side effects from many medications. These include decongestants, antihistamines, and meds for acne, fluid excess, blood pressure, and bladder spasm meds. Environmental causes include extensive reading, eye surgery, excessive computer use, contact lenses, low humidity, wind and fans in the face, and the result of a diet without enough oil or certain minerals and vitamins. Primary medical causes for dry eyes include immunological conditions like diabetes, rheumatoid arthritis, lupus, scleroderma, low thyroid, Sjogren's syndrome, vitamin A deficiency, and just plain aging. Dry eye affects twice as many women as men, and in the US alone we spend $3.8 billion in healthcare dollars for this condition, with societal costs estimating at $55 billion a year. For treatment, we should focus on which situations cause symptoms, and then find ways to avoid those situations. We can include in our diet enough fish, flaxseed or flaxseed oil, liver, carrots, broccoli, and walnuts. Protective eyewear can help. Doctors treat some cases with surgery by plugging the tear ducts that drain tears away. Eye drops that reduce inflammation can help. Artificial tears are often prescribed, but as helpful as tears from a dropper may be, they are never as good as the real deal. Nothing will ever compare to the value and the sacredness of a human tear.